I'm here with,
Aldrin.
and where you from?
I'm from Philippines, but I've been living in London for 6 years now.
And what brought
Yeah,
you to the UK? Why did you come to the UK?
I'm working here.
What do you do?
I'm a nurse.
Okay, fantastic.
Yeah,
Thank you for your contributions to the NHS.
you're welcome.
And how has the UK changed you as a person?
It's my first time working in overseas, so it was a big change. I came here during pandemic time, so it was like crazy. It was a crazy experience, and everything is new. It's pretty different from my country, from where I'm from, but it took a couple of years, but I feel like I'm well adjusted now. And it changed me as a person. I become more independent. I become more open to new things, open to try new things, and a lot of opportunities to like see things around outside the UK and going travel around Europe. So that definitely changed me as a person. I'm definitely more ready to go to other places, or if ever I decide to do that one day, I'll be able to do that easily now because I've been living here for a while.
And do you think there was anything unique about the experience in the UK that I guess contributed to that change compared to going anywhere else?
Number one, the healthcare system. I think, I mean, a lot of people do complain, and I can't blame them about NHS, but I guess it's one thing that sets the country apart from other country because other countries don't have that. That's definitely one thing, one of the big difference.
And were you working as a nurse in the NHS during the pandemic?
I was, yeah.
Tell us about that experience because that's got to be, well, I guess in a lot of ways, life changing for you to see everything that was taking place there. What were some of the things that you saw that you think is important for the general public to know about how things were as a nurse or healthcare professional in that time?
Oh, it was mad. It was a mad experience. I mean, I remember telling myself, like, I only see this in movies. Like, I remember one time I was walking on my way to work, and it was like a totally dead, like I'm the only one walking around the area. So that felt really bizarre, like in the movies. But it was crazy times. I took care of a lot of patients. It was really heavy. A lot of people might not know, but nurses went through a lot during the pandemic time. This might sound really controversial, but we appreciate the clap, but we need more than the clap, guys. Just, we need a salary update. And the wages, for sure.
I could completely understand
Yeah.
that. Yeah, and I definitely appreciate all the
you.
work of the NHS professionals. In terms of how patients were with COVID, and I guess with you as well, did you catch COVID during that time? How did you manage yourself
Yeah.
and your own health in that period of time?
I did catch COVID. I think I was part of the first wave who experienced that. And it was crazy because people don't know what to do or what to expect. I thought I was dying. I thought that it's going to be the end of my life, but I got through it. I probably had the COVID like 3 times because we're very exposed. And patient-wise, I mean, I was working in a very high dependency unit. So a lot of people are dying. It was really sad, but you have to keep going. You don't have time to process it as much. I think it took me like a year after the pandemic to actually process how hard work it was, how emotionally draining it was, and then just came to terms with it. And then just one piece of advice is to always look after your health and your mental health as well.
Well, I'm very
yeah.
glad that you're still here.
Yeah, I am too, yeah.
And I guess you talked about it, but all of that mental strain, what kind of support was there for you and for the other NHS workers during that point in time to deal with that, seeing people dying day in, day out? I mean, that's got to be beyond traumatic.
It is beyond traumatic, and the fact that a lot of workers are sent home because they're vulnerable and they have like an existing illness, it makes it a lot more harder because we didn't have much. I'm not saying we didn't have much support, but we did have to go through it by ourselves and just push through it. And right after the storm, that's when the help came along. Like, we had some support with our mental groups in the hospital. A lot of initiatives were done, but during that time when it was happening, it wasn't an option. So you have to brave through it. Like, you need to just go through it.
And if you can talk about this, how was it in terms of, I guess, staff turnover or just staff staying or being able to manage through that? Obviously, you persevered and you were able to manage and overcome, but how was it for other people?
I've known a lot of people who lost their lives. A lot of nurses lost their lives when it was happening. A lot of people never went back to work anymore because they were affected with it. A lot of staff deficiencies, so we were understaffed for sure. And it was a challenge because you're expected to look after like probably 15 to 20 patients a day. And it was crazy, but you can't do anything because you have a job, you have a responsibility, you owe to look after people and to like be there for them. So staffing was like really quick. I think it's still an existing problem at this point, but I'm pretty sure the government's doing a lot of initiatives to actually make up for it. So we'll see what happens, really. But I'm really hoping for the best.
So am I, so am I. And
Yeah.
again, thank you to everyone who contributed during that time, and to those who lost their lives. Like, we thank you
Yeah.
for everything that you did, and we hope that your memory continues to live on and be a blessed thing for you and your loved ones.